Hello, everyone, and welcome back to another session of Ask Me Anything. I am Karishma from iMumz team, and today we are going to discuss an interesting topic of cesarean section versus normal delivery. So we all have these choices of how do we want to give birth. Should it be natural delivery, or do we want a painless delivery? And in what cases C-section is preferred, in what case vaginal delivery is possible? What are the complications, pros and cons? So let us find out more on this topic from our expert, Dr. Nisha Singh. Today we have with us Dr. Nisha Singh, and I'll introduce her in a minute or two. So, Dr. Nisha Singh is currently the unit head and in charge genital cancer control unit in the Department of Obstetrician and Gynecology of King George's Medical University, Lucknow. She has done her MBBS from LHMC New Delhi and MD in OBGYN from AIMS New Delhi and even the senior residency. And she's the secretary of Lucknow Obstetrics and Gynecology Society and the fellow of Indian College of Obstetricians and Gynecologists. She has been an observerships of Stanford University, Barts Cancer University in London, RUH Canada, TMH Mumbai, and she has done her endoscopy training in AIMS New Delhi. She has been awarded with many awards. She has been the Best Faculty Award and has got six Academic Brilliance Awards in 2018, Bharat Jyoti Award of IIFS and Best Paper Foxy in 2010, Sushin Chikitsa Seva Gaurav Samman in 2019, and many more awards. She has published 100 plus books and chapters, many publications. She has presented in national and international conferences and even organized them. So we are very, very glad to have you with us, ma'am. Uh, and with this, I hand it over to you and you can talk about the topics. And I request the expecting mothers to post their queries in our app and we'll take them one by one. Thank you so much.
Yeah, thank you so much, Karishma and the iMumz team for having invited me here for this program. And the topic that you all have chosen is a really interesting one and kind of close to my heart also. And that is cesarean section versus vaginal delivery, which is the most important, query in the mind of the would-be mother, that how is it going to be. And nowadays it's not just a query, people have their own choices about it completely. So thank you so much for inviting me here. Now, as I talk about this topic a little bit, we all know that God has made a natural passage for delivery of the baby in the human beings. So that's a vaginal delivery. And there are mechanisms on its own that how some hormonal changes take place once the baby is mature enough to come out into the new world. So the labor pains start on its own mostly, and then there are contractions in the uterine muscles. They contract regularly, and gradually there is dilatation of the passage, which is the cervix, and the baby can come out from that route. That is the normal vaginal delivery. And in most of the cases this is what the norm is, but many a times the woman may not go into a normal labor, and then there are reasons to induce the labor, that is start the pains by some medication or by some methods. So we do that after admitting the patient, and then again the purpose is again to do a vaginal delivery. But there are conditions in which a vaginal delivery is not considered safe for the mother or the baby. So, like for the mother, there could be conditions like the mother has a heart disease, which is a very severe type of heart disease. She cannot tolerate the stress of labor due to the type of heart disease. So, not all heart disease, but some of them could be there, like the coarctation of aorta or the mitral stenosis. Sometimes, some of you, if you have, you will be knowing about that. So, women who have a heart disease, a diagnosed case, then according to the severity, it will be decided whether she can have a vaginal delivery or a cesarean will be needed. Similarly, if the passage is too narrow, and then the doctor or your gynecologist examines you and finds that the bones of the pelvis through which the baby has to come out is too narrow, it will get stuck, then they advise you to go for a cesarean straight away. Then there could be a condition like, say, previously you have had two or more cesareans. Then in that case, we do not have recommendations as yet to allow vaginal delivery in a woman who has had two or more cesareans. But remember, mind it here itself saying just one cesarean if a woman has had, then we do not say that you must go for another cesarean. Then in that case, you can go, we can give you a trial depending upon the conditions, that you can still have a vaginal delivery if you want so. Then there could be other things like, sometimes there is a condition known as placenta previa, in which the placenta is coming down into the lower segment where the passage has to open. So if that condition is there, then again vaginal delivery is contraindicated, it is not allowed, and so we allow we take these patients on cesarean section only. Now then, apart from that, there could be conditions like the babies, there are, these are all elective cesareans, that is planned cesareans, but emergency cesareans will be required in lot of conditions. Whenever a woman is having, say she, the baby's heartbeat is, going low, or it is too fast, or baby has passed stools inside the uterine cavity only, during labor. These are all signs that the baby is not healthy inside, baby is having some distress, we call it a fetal distress. So in that condition also, the patient will be taken up for an emergency cesarean. Then another condition where emergency cesarean can be done if the labor is progressing, but it is very slow progress and it is taking too much time. Then in that case, you will be taken up for a cesarean. So there are time limits that we have to see. So any time during labor, if there is an indication that the mother or the baby are at risk for continuing this, they will be taken up for cesarean section. So these are some of the common conditions where the obstetricians or the doctors will themselves tell for going for a cesarean section, and we take the consent and then we take them up. But nowadays many times the mothers are coming to us and they are saying that they need to have a uh, cesarean section, although the doctor doesn't say that. So in that case we have to counsel the women. You have to see, you have to know the pros and cons. So see, let's see about vaginal delivery. Of course, what women are mostly scared of, what I believe with that, with whatever patients we have, there could be that there is they have a fear about the pain that they are going to, they are not able to bear the pain. So for that, I just want to let you know that there is something known as the epidural analgesia. So with that painkiller, we have some mechanism, not we give some drug through a catheter placed in the back, and that can reduce your pain during labor. You can tolerate the pain. So that those are the things that is the most common reason. Otherwise, if you see that after a cesarean section, you have to stay in the hospital for at least 3-4 days, and then only you will be discharged. Then you have to come back for suture removal also. So there is a later recovery in cesarean section, although you do not feel the pain at the time of surgery because you are under anesthesia, but after delivery you have to have some pain and some discomfort, and it takes time for the recovery, much more time in a cesarean as compared to a vaginal delivery. So that is what I have to say about the women who are fearing a vaginal delivery just because of the pain. So that's one. Then the other things, like for vaginal delivery, yes, the duration is prolonged. You have to be monitored. So actually, if you see, it is for a doctor, it is a longer duration of monitoring that is required, because labor process, it takes 12 to 16 hours easily. So it has to be a center where you have enough people to take care of you, monitor your vitals, the pulse, the blood pressure, and then your fetal heart rate, and then only a good delivery, a successful delivery, and a delivery without any harm to the mother and the baby can take place. So the center has to be very well equipped to monitor the labor progress, and also monitor the well-being of the mother and the baby, and take care of the hydration, take care of medications that are required, and pick up any emergency situation where there might be a need of a cesarean section. So that is how, it is happening most of the times, that though the patient thinks that it is better to get a cesarean done, and for the doctors, cesarean is just an half an hour or maybe 45 minutes job for that time, but for the patient, the post-op recovery takes more longer time. While in a vaginal delivery, it is more of this thing for the doctor, because the monitoring has to continue for 16-18 hours, and then of course the delivery process is maybe 10-15 minutes only, and then the mother is all right, she's able to feed the baby, she's able to take care of the baby much early, because she can move around very fast. So these are the differences in the two methods of delivery. Then apart from some other complications I told you, there could be also, see, some of the women who will have, I talked about heart disease, then raised blood pressure, which is very common nowadays. If there is an increase in the blood pressure, that also doesn't necessitate that you will have to go for a cesarean delivery. You can induce the labor, and then she can have a vaginal delivery also. But there are conditions when you have a conception very soon, like one, we say that the inter delivery interval, that is from one baby to the other baby, it should be at least 2 years, 3 years. But we say if the interconception interval is less than 18 months, then definitely we would want that there is a high risk that the uterus may rupture during labor, so we advise a cesarean section in this case also. So then big size babies, if the size of the baby is too big compared to the vaginal root that is available, the size of the pelvis that is available, and in those cases also we may advise a cesareans directly. So all in all, I just want to say that the instead of just having your fears, you should talk to your doctor, and based on the uh, assessment, because it is a very individualized assessment, one should take a decision whether it should be a vaginal delivery or it should be a cesarean delivery. So I think, Karishma, a basic introduction I have given. If anything more you would like me to add on to this, you can let me know.
Thank you so much, ma'am, for giving wonderful insights on the topic. We will go on to some of the queries.
Okay.
So, one of the queries is what are the reasons behind more cesarean than normal delivery?
Okay. Uh, yeah. So as I said, that one, women are scared of the pains. That is one. So many women feel that they will not be able to bear the pain which is there for a long time, 16-18 hours. So they hesitate in doing going for that. Is the elective indications. So they tend to refuse. But apart from that, also they feel that they want a timed delivery, they want some muhurats, or some specific timing according to whatever religious beliefs or something. So sometimes they want a cesarean for that. then yeah, because we have seen women coming, and then certain days in the year or in the month are not good, or in the week are not good, so they would like to go for a very planned, and they would have all the arrangements done, the family is ready, everybody is around. So many times I feel that these are all social reasons which are actually becoming an indication for increased rate of cesarean delivery from the elective surgery point of view. From the emergency point of view, we have obstetric complications, and over the years we have been able to detect them, because we have methods to know that the baby is not doing well, a very close monitoring is being done, or so we are able to pick up, as I said, fetal distress if it is there, or we are monitoring the labor, and anytime it is going prolonged, we ourselves say that no, this will be risky. So in order to have a emergency cesareans are done for the well-being of the mother and the baby. If the mother cannot sustain the, if the blood pressure is going very high during, so in all these conditions, so it is both ways, it is both from the patient side, and as well as from the medical side also, because we are able to detect problems much more than before. So we are able to intervene in the form of cesarean section much before. So that's how I feel that the increase has been both from the medical community side as well as the patient side.
Thank you, ma'am. Rashi is asking, is it normal to feel pain in the abdomen after C-section? It has been 26 days and she's feeling pain below navel and above the incision.
Okay, 26 days. See, usually what happens, there is a pain in the stitch line and around it till the stitch line heals. There is healing and there is joining. That is about, say, 8 to 10 days normally. Then apart from that is the pain that happens because the uterus is contracting. Uterus, which was such a big huge size, now is gradually reducing down to its normal size. So in the first 2 weeks it takes time for the uterus, there are some uterine contractions also, and especially when you feed the baby, then there is some contraction. So intermittent contraction of the uterus happens in the first 2 to 3 weeks. That may be a reason that you are feeling pain off and on sometimes. But if it is continuous pain, if there is any redness in the stitch line, then or there is some discharge from the stitch line, then it is a reason to go and show to your doctor. Otherwise, mild pain, or just a little bit of heaviness because you have started moving around, you're walking around, that may be all right.
Thank you, ma'am. Uh, Pujal is asking, what is the maximum weight of baby that can be delivered normally or vaginal delivery?
Okay. So, see, according to the guidelines, if you see world over, they take 4 kgs as the cutoff. In Indian setup, because we consider that our women are not as tall, or the size of the pelvis would not be. So, usually, by and large, if it is more than 3.5 kg, we have to do a really good assessment by a senior obstetrician, and then we decide to take the trial of labor. So it is, if it is a 3.5 kg plus baby size, then we usually say that we can only try, and that too if the pelvis is looking like normal size or a very spacious pelvis, then only we'll give you that trial of labor. Otherwise, by and large, more than 3.5 kgs, usually obstetricians mostly would say that it is, I mean, they will at least explain you that there are high chances that this baby may not deliver. So it is an individualized assessment again, according to the height and build of the patient, according to the size of the pelvis. So one after 3.5 kg, it has to be a judicious decision, individualized decision from patient to patient.
Thank you, ma'am. Uh, Somilita is asking, what should we do to have a normal delivery?
What should you do? See, if you all, I'm sure many of you must have seen videos and you must be knowing, like, see, the vaginal delivery will happen in a position which is like lithotomy position, we call it. So basically, if you are used to, you are working, you are moving around, you are doing some kind of exercises so that your pelvic floor muscles are strong and you have good mobility of your limbs, and you are able to put yourself in that position, and like the antenatal exercises are told about. So if you do all that, it will be an easy delivery, definitely. So if all I can say, that what should you do to have a vaginal delivery, as I said, your doctor will decide what is better for you. But to facilitate that, doing those antenatal exercises and making yourself healthy and strong that way is good. So that will help you if you do some breathing exercises, some limb movements, some adduction abduction exercises, so that you can put yourself in that position during the delivery and you are not having any kind of pains and aches, because if you are just not used to, then it will be a little difficult for you. So exercises will help you.
Thank you, ma'am. Shweta is asking, I had my C-section on 10th August, but still I feel numbness below the navel area. Please let me know when will it go and what can I do for it to go.
Um, 10th of August, it's been quite some time actually, and now I feel it is ending, September ending. You shouldn't be having actually a numbness below the navel. Maybe you can just show to your gynecologist if there is something. Otherwise, I don't think there should be any reason which should be related to the cesarean section. It shouldn't be there.
Thank you, ma'am. Malika is asking, hello doctor, I'm 24 weeks pregnant. This is my second pregnancy. During anomaly scanning, we got to know that VSD in fetal heart. Then during echo scanning, we got to know that fetus has choroid plexus cyst. Cyst is noted on posterior horn of both the lateral ventricles. I'm very much worried, doctor.
Okay. So yes, I understand that ventricular septal defect, which is a small anomaly in the heart, and in the choroid plexus, you're seeing a cyst, but you are 24 weeks. So ventricular septal defects, although they are heart disease, a kind of a heart disease, but it's a very minor kind of heart disease. Usually, it can, um, it has to be followed up, and since you are already 24 weeks, the best thing that can be done is just to follow up. Sometimes these choroid cysts may disappear, and because it is uh, 24 weeks, it is almost towards the time that we cannot actually much take a decision on that. Maybe have they done some kind of serum markers or something in you? Have they counseled about any other problems that are there? It will depend on that. But just isolated, if you see these are the two anomalies, yes, a little bit of, but it will be correlated with the other blood tests and all, and then only the decision about anything can be given further. So your obstetrician would be the best person to tell you, and because one will have to see all the reports, also other reports in that case.
Thank you, ma'am. Pujal is asking, do girls gain more weight after C-section delivery?
No, it is not so. Now I think seeing everybody, you see so many celebrities coming up, and you see in general, whatever weight gain happens during pregnancy. So whether you go for a vaginal delivery or you go for a cesarean section, the weight has to be shed, because and you have to really work on it, because it doesn't go off on its own. Some people have this natural thing that they don't have to work, but by and large most people will have some weight gain after a delivery, whether vaginal or cesarean. In cesarean, comparatively, it is thought that it will be more because the mobility, as I said, that because the recovery of the wound, it takes time. It takes time for the wound stitches to heal, about 8 to 10 days, and then also the underlying inflammation to go off. So people start moving around and doing their activities later as compared to vaginal delivery. That difference definitely is there. You can call it a difference of say 15 days, but apart from that there is no other difference. So once you've had a delivery and you start moving around, you have your diet, simultaneously you have to start doing some exercises. The problem is that because you have a baby, you have to take care of the baby, you have sleepless nights, and you are breastfeeding. So with that, mostly it becomes difficult to have a schedule in the whole day that you find time for your exercises also. And actually that is the reason for the weight gain. It is not actually that you are eating too much, or you are it's because of the cesarean. It is just because one is not able to have a schedule. You don't have so much time with the baby that you pay attention to your body weight control. So that's all I have to say, because cesarean you will do it a little later. In vaginal delivery you can start doing a little early, but one has to find the time to do that. That you have to do. So weight gain can happen in both. You just have to do some work on it to reduce maybe the kind of diet. You have to have a balanced diet, but not too much of fats, and high protein diet again, and lots of green vegetables and fruits. So you have to take control of all those things. Although usually in the traditional way, in the postpartum period, you are made to eat lots and lots and lots. So you have a good meal, you have extra calories which are required for a lactating mother, 500 calories extra more than what a non lactating mother does. But simultaneously take care of some exercises, then the weight gain will not be there.
Thank you so much, ma'am, on elaborating on the topic. And because we are on the topic already, I would just say that on the Saturday, we do have a weekend webinar in the parenthood section or the motherhood section of our app. And if you want to join, if all the expecting mothers want to know about postpartum weight loss, so we have our dietitian who is going to talk about it in detail. So you can check out the motherhood section of the app and after the session, and feel free to subscribe it for it as well, because we would like to be a part of your journey throughout, not just pregnancy but also continue to be a part in parenting as well. So I'll
Yeah,
move on to the.
yeah. I was just complimenting iMum's app for these initiatives that, yes, they can learn the exercises and all from there. Yeah,
Thank you, ma'am. Thank you so much for encouraging words. So I'll move on to the next question.
yeah.
Uh, Jaya is asking, hi ma'am, I'm 36 weeks pregnant and doctor says I should plan my planned C-section post 37 weeks as I had previous emergency C-section. I'm willing to wait until I am at least 39 weeks. Can I do so?
See, the normal time, in fact, when we are doing an elective cesarean, nowadays we say that it should be done at around 39 weeks, 38, 39 weeks, and that will give us a good maturity of the baby who comes out. If we do it earlier, we have to give some injections for the maturity of the baby. So that way you are fine, you can wait. But I do not know when was the last cesarean done. And as I talked about the interconception period, if that is less than 18 months, then if an elective cesarean is to be done, then maybe 37 plus is a right time to do that. So the decision would be based on a lot of other things also, when to do the cesarean. But if there are no risk factors otherwise, we do a cesarean at 39 weeks. So you have to just check on that, that what is the special reason that she wants to do. If it is a justified thing, then you'll have to agree to her. Otherwise you can ask her for continuing till 39 weeks.
Thank you, ma'am. I'll move on to the next question from Thea. She's saying I'm having AFI 8 at 21 weeks of pregnancy. Can I have normal delivery? Do you think I need IV fluid? My doctor has prescribed Enzoparin 40 mg daily for 2 months, starting from yesterday. Is it fine to go with it? Do I need bed rest now? Please guide for normal delivery.
Is the drug, Karishma, could you just repeat the drug that she's saying? Is it enoxaparin injection, 40 mg?
Uh, ENXOPARIN.
Yeah, enoxaparin. Yeah.
Yeah.
Okay. So it's an injection that she has been advised, and the AFI that she said of 8. Actually, at 21 weeks is too early to really measure the amniotic fluid index. But if the total, whatever they are measuring, is 8, it is not too less. It is all right. So I do not personally feel that she needs uh, intravenous fluids. That's one. And second thing is about vaginal delivery. Of course, you haven't mentioned any other, thing. Is it your first pregnancy? Was it her first pregnancy, Karishma? Did she write?
She has not mentioned that.
Okay.
Uh,
So if there is no other reason, if it is your first pregnancy and you're just 21 weeks and there is no other systemic illness that you have, a heart disease or a high blood pressure or diabetes, or there is nothing else, then obviously you can go for a vaginal delivery. I don't see a reason, but because I do not have your whole history, I cannot say that with certainty. And then regarding the liquor amount, as you said, 8 AFI, as I answered for that, it is not, the liquor is not too less, but we usually do not measure the liquor in the form of AFI at 21 weeks. We do it after 28 weeks or so. And the third part that she said, enoxaparin. Okay, enoxaparin, I'm not sure for what indication. Usually it is given if somebody has, some apla syndrome. There are some conditions, immunological disorders, in which we advise this. So I'm not very sure what is the reason. Your doctor must have told you. You should ask her. If we do not normally give it for the uh, amniotic fluid being less, we do not give it routinely in every pregnancy. There has to be some strong reason to give that, which I don't understand from your history. Okay.
so she has mentioned that it's her first pregnancy.
Okay. So with first pregnancy, and so enoxaparin, immunological disorders are the ones in which we usually give, which I don't think is mentioned in her history. So I'm not sure. She'll have to ask her doctor what is the special role of this drug, why she has given her that.
She's saying that blood pressure is fluctuating. Sometimes it's normal, sometimes BP is 150 over 80. And most of the time, her BP is normal.
So, but this is not a drug for blood pressure. Enoxaparin is not a drug for blood pressure.
Okay, I think Thea, it will be the best if you consult your local gynac and take it up from there, right?
Yeah.
All right. So I'll move on to the next question. Saloni is asking, I have itching in thighs and stomachs and hands. She is now in 31st week and doctor says apply lotion for a week or will perform LFT test.
Okay.
So,
So, yes, I'll talk about this. So, this is a condition in which the woman has itching over the body, more over the abdomen and the thighs. Actually, on the hands, limbs also, it can be there. So, this is a condition, and if she's not relieved of this, perfectly all right. She has given some lotion. If it is not relieved, then she will do a liver function test or the LFT test. And if that comes abnormal, and there is another test called the bile acid test. If they come abnormal, then it is a condition known as cholestasis of pregnancy. So that is a condition in which the itching is there and your liver function tests are deranged. And in that case, that is to be managed with the use of some medicines that will be given, and more close monitoring of the baby will be required in this condition. So it let them, I think they're going on the right track. If you're not relieved, you should go for that test, and according to the test result, take the medications.
Thank you, ma'am. Uh, so, Amrita is asking what are major care or recovery steps or measures that to take for both types of delivery?
Um, what are the major? What did you say? To for both
What
types
are
of
major care or recovery steps or measures?
So, recovery steps, like if you have a vaginal delivery, let me talk about that. So, in that case, just a second.
Sure.
Yeah. So, in that case, you will have to, vaginal delivery case, see, mostly they will have some stitches in the perineum. So, that is the issue for which the care has to be taken. And so, recovery will just depend upon the healing of the stitches. All women will not have the episiotomy stitches, but those who have, it will depend upon that. Otherwise, she is able to move around. She will have, if it is an uncomplicated vaginal delivery, then she'll able to, right from the day one, she's able to move around, she's able to pass urine, stools, she's able to have a full diet. So there is nothing much to tell in the case of a vaginal delivery how to take care of her recovery. You have to just take a balanced diet, you have to take care of those postpartum exercises, and you have to move around. You can even do some amount of household work also. So that is about the vaginal delivery. Only the episiotomy wound has to be taken care of, which heals usually in, say, a week's time, and not all women will have the wound also. But in case of a cesarean, of course, as the doctor advises from the day one, usually the next day you will be allowed some liquid diet and then soft diet. Then gradually, once you will be coming up to a full diet once you pass tools. So mobilization also nowadays we start from day two only. We start patient to get up, do some kind of chest physiotherapy, movement of the limbs in the body. So early ambulation is always very useful for early recovery. So ambulation is important, you should not avoid. So yes, you will have little pain, little discomfort, but you should try to get up and you should come out, try to move around from day 2 to day 3, and gradually you will start feeling better. So early recovery depends a lot on the ambulation, on the diet that you take, and the way you perform your day to day routine after that. So in cesarean section, and it will depend upon the medical condition that you have. If you do not have any, if you have had some complications, your blood pressure was not normal, or any other severe pain, or your stitches did not heal properly, then obviously it will take more time. But otherwise, taking early ambulation, early moving around, taking lot of fluids, and having a good diet will help you in the early recovery. So one has to, mobilize herself. That is the most important thing that I would say, and gradually take over to the special exercises that are there. They will help you in the recovery. Take your medicines, take your, iron, calcium in times. Take care of some contraception, which is very important after the cesarean. Do not just leave that. Plan some contraception before only, that is during the antenatal period only. If you plan, you can tell your doctor, she will give you something. An IUCD can be placed at the time of delivery or at the time of cesarean. So that these are the things that will make you mentally also free. So physical health, then mental health, then social health. The family support is also important. Psychosocial support is also very important. Loving care in the family, all these things are going to help you in a faster recovery. But the most important is your own willpower. The longer you keep feeling, uh, sick, it will take more time to recover.
Thank you, ma'am. And as you mentioned things about mental health, and there was a related question like, can you have an anxiety attack while C-section?
While C-section, you will not have an anxiety attack, because the cesarean section will be done under anesthesia. some kind of anesthesia. There are two types of anesthesia for cesarean, I'll tell you that. So one is called the regional anesthesia, which is spinal or epidural. Regional means only a part of the body is made immobilized, so they give an injection in the back, in the backbone, and that makes your lower abdomen and your thighs and lower limbs numb, and so that you do not feel any pain when the surgery is being performed. This is a regional anesthesia. There is another way, that is the inhalational anesthesia or the general anesthesia, in which a tube is put into your it's into the trachea, and then they are giving you drugs and maintaining your ventilation. So nowadays, mostly cesareans are done under regional anesthesia. Only some conditions will need a cesarean in general anesthesia. So in general anesthesia, you are completely, you are not aware, you are not able to see or feel. So chances of anxiety attack are not there, but there could be complications of any of these anesthesias, although nowadays they are very safe. But as you all know, for any surgical procedure, for any anesthesia procedure, there will be some percentage which will have some side effects or some complications are possible. So that is another reason that compared to, we simply say, compared to a vaginal delivery, the cesarean delivery will have comparatively little more risk, because it is a major surgery. Your abdomen is being, cut in layers, and then the uterine cavity also, and then the baby is coming out, then all of it is going to be stitched, and then the complications of anesthesia also. So I do not think there would be an anxiety attack, but any complications related to anesthesia or the surgery are, they do happen once in a while. Don't have to be scared of it, but one has to give consent for that when you go for a cesarean delivery.
Uh, and ma'am, how many C-sections can be done to a same person?
At some places in the world, like when they have too many children, if I quote, people have had five, six, seven also. But like we have the norms, uh, usually after two cesarean sections, the chances of adhesion formation, even after one for that matter, adhesion formation, and that is individualized. Different people will have different reaction to the stitches, the suture material that we are using. So they will develop some kind of adhesions in the body between the uterus and the abdominal wall. So because of those adhesions, every time one more cesarean is done, it leads to bleeding. It leads to, it takes time removing those adhesions and entering the uterine cavity. So I would just say that with each cesarean, which is a surgery, which is requiring a procedure and then suturing again, you are increasing on your risk for complications in the next pregnancy. So obviously, uh, more than two, going for third or fourth cesarean, every time the risk goes on increasing with each surgery performed on the same individual. So it is not overall a very good thing. Here only I would like to now say one very important point which I did not mention in the introduction, and I want all of you to hear. Over the years, there has been an increase in one more condition which is called placenta accreta. I don't know how many of you have heard about it. What happens in the first cesarean itself, the place where we cut and then suture, the scar that is there in the uterus, when you have a next pregnancy after that, the placenta, if it comes into the lower part of the uterus, it tends to get, stuck to that scar site. And because it gets stuck to that scar site, it tends to, it will not get separated at the time of delivery, and that may lead to severe bleeding, severe hemorrhage, and sometimes women will need to have a hysterectomy also, removal of the uterus also. And over the last decade, I would say, or 2 decades, we have seen, as obstetricians and gynecologists all over the world, we have seen an increasing number of cases with placenta accreta, and it is a very serious condition. It increases the risk to the mother to hemorrhage, blood loss. Lot of blood is required to be replaced. So every cesarean adds to your risk of placenta accreta, which is a very serious condition. So I would never say that take it very lightly and just go on getting cesareans. No, even with one cesarean, the second cesarean, you have an increased chance of having a accreta, placenta accreta, or we also call it morbidly adherent placenta. So these cases over the years are increasing, and it becomes a real challenge to save these mothers. Lot of blood transfusion. So that is one point I missed during the introductory session, and I really want you all to understand this, that with each cesarean, you are increasing the risk for some complications which are only because a cesarean has been done. That's why we do not recommend that you just go for a cesarean just for the fear of pain. I hope I'm clear on that.
Thank you, ma'am, for making it clear to everyone. Um, so, one of the questions that Saloni had as a follow-up question, she wanted to really wanted you to elaborate on LFT test. Is it harmful, and are there any home precautions?
Okay, so that LFT test is not at all harmful. It's a simple blood test, and which is telling you about some levels of some enzymes in the body, and which makes us helps us making the diagnosis of cholestasis. Now, that condition cholestasis is not a very serious condition. Usually, your the medicine that will be given will control your itching and also will control the LFT abnormality. It will gradually control it. And only thing is that in this condition, we usually take up the pregnancy to 37 weeks, and then we ask to deliver. And up to 37 also, we keep you in a close monitoring method, that is by the fetal movement count and by the help of the non-stress test. So more frequent visits and more frequent monitoring by these non-stress tests and the ultrasounds would be required. That's all. I do not there is nothing to be very scared about it. It is a common condition nowadays, and if you go on following the advice of your doctor and go on doing a close monitoring, it will be taken care of well, so don't worry.
Thank you, ma'am. Kaveri has a question. She has a tendency of forming keloids. What
Okay.
is recommended, C-section or normal delivery?
Keloid formation happens in the scars. So obviously, I mean, this will not be the only indication to decide. But obviously, if you will have a cesarean, then the keloid formation may be there on the scar. While if you have a vaginal delivery, the chances will not be there. So as far as keloid is concerned, vaginal will be better for you. But if needed, you will have to go for a cesarean if it is for the safety of the mother and the baby. So it's not just keloid is not the only thing that will matter. Yes, Kaveri.
Thank you, ma'am. Uh, so Sneha is asking, hi doctor, I'm on 29 week of pregnancy. So far don't have complications. I am on LWMH and ecospirin 150. My doctor is recommending to deliver at 36 weeks via C-section, as she is assuming baby will be 2.5 kgs by then. Why C-section only? My last delivery was normal. Can I try normal?
Now, I do not know why the LMWH, that is low molecular weight heparin. You know, somebody wrote about enoxaparin. Enoxaparin is a low molecular weight heparin only. And ecosprin, I don't know why they have been started. Do you have an APLA syndrome? Do you have some immunological abnormality? Or you have high blood pressure? I mean, has to be some reason that she has started these things. And then because you have had, or the baby's growth is being affected, so something, there would be some reason for starting these drugs. And probably your early delivery that she's planning, normally we do not plan before 37. until unless, I mean, even with some complications, mostly we try to go up to 37 weeks. So I really do not know why insisting on 36, but that has to do something to do with the medications that you have been started upon. LMWH and ecosprin, yes, mostly either in high blood pressure or immunological disorders. I feel immunological disorders. Have they done some test like APLA test or lupus anticoagulant, anticardiolipin antibody, something like that they must have done, and that must be abnormal. So they must be doing. But in
Oh,
that case also, we do not deliver at early 37. We usually take till 37.
so she had a previous history of IUGR.
So how much time is left, Karishma? Just getting some
Uh,
important calls.
yeah, yeah. Would you mind giving more 10 minutes?
Yeah, or can I take the call?
Or you can take the call, it's fine.
Okay, let me
If
just complete this question and then I'll come back after the call. What was this question?
Sure, sure.
Yeah, she
So
had
Sneha, history of
IUGR
IUGR.
in the previous pregnancy. So maybe, yeah, I understand. So maybe that is the reason they have started. And this time also, either the growth is showing a little less. That's why they are talking about 2.5 kg growth. So maybe she's correlating like that. But usually there it's a long way to go from 29 weeks. So maybe, it is, there is something more that she can talk to her doctor. I'll just take that call and come back, please.
Sure,
Yeah.
sure. We understand. So, uh, we obviously all understand that our doctor might have to address some emergency calls. So, in that case, let us just wait for a while. In the meanwhile, I would really apologize to everyone because there are so many questions from everyone, and it's almost impossible to take all of them and including follow up questions in the next 10 minutes. We will take the remaining questions in the next AMA as you post it, and you can also post the queries in the feed section, so we will get it answered by our doctors. I see there are many questions that are repeated, and those are like answered in some or the other previous AMAs. You can go back and check them. Also, so there are questions on epidurals, and you're planning to host a separate AMA on those topics. I think they are subject in themselves. So yeah, and I have like many requests of taking this question.
Okay,
So,
I'm back,
yeah,
huh? I just told them I'll be with them after 10 minutes. Yeah, please.
thank you, ma'am. Thank you.
Yeah.
So, yeah, there are a lot of requests of questions, but obviously it's not possible to take all of them in 10 minutes. So, we'll try to cover as many possible. So, Kruti has a fibroid of medium size. Is normal
Hmm.
delivery possible?
Okay, medium size means what? I don't know, but I believe it is around 5 centimeters. See, it depends upon the location of the fibroid. That's a nice question. I like it because many times, because of fibroids, people advise abortions to go for MTPs or anything, and even take up for cesarean. I would say it depends upon the location of the fibroid and
Six
the size
centimeter.
of the one. Okay, 6 centimeter. If it is in the upper segment, in the outer wall of the uterus, she can very well go for a vaginal delivery. It's not a problem. Only when the fibroid is in the lower part of the uterus that it is going to affect the vaginal delivery. Then only some decision might change. Otherwise, if it is in the outer wall and it is in the upper part of the uterus, you can go for a vaginal delivery. Yes.
So there are some questions related to the weight during the pregnancy, and I think doctor has covered the information on that, the weight of the baby. So I think you can go back and check it. So I'll move on to another question. Um, BDC is asking, hello doctor, I had my AST closure at 2017. After that, I'm fine. Now I am 32 weeks pregnant. Can I opt for NBD if everything is normal as per protocol?
Atrial septal defect, ASD closure done. Your cardiologist will be a better person to tell you that. I personally feel again with atrial septal defect also the vaginal delivery can be done most probably, but you just consult your cardiologist also once. Okay.
Uh, Thank you, ma'am. Joshita has a question. She's asking, there is a difference in my original LMP and LMP calculated by USG. According to USG, I am 6 week and doctor says size is small and asked for Fertigen 5000 IU. Can you please help if it is fine?
um according to
And
the,
she
yeah.
has a history of PCOD, but no cysts are saying now. And it's her first pregnancy. Difference between LMP is 8 days delay.
So, difference between the age of the baby by the LMP and age by ultrasound, that is only 8 days, is not a big difference. Number one, it's just 1 week. That's okay. Number two, that she's giving you Fertigen for maybe it is kind of support that she wants to give, a luteal support that she wants to give. So for some reason, if it was PCOS, I don't think that should be the cause. But generally when we feel that there are increased chances of abortions or something, then we give this kind of support. So maybe that's the reason. But cysts and all, whether you see them, see pregnancy, once you have conceived, then things will be different. You may have a corpus luteal cyst, you will not have the normal PCOD, cysts will not be there at this time, so there is nothing to correlate that with. So but Fertigen, some people give empirically also, some people give to whenever there is an increased risk of abortion, then also it is empirical. You never know so it is a hormone actually that is being given to give more support to the growth of the baby.
Thank you, ma'am. So there is a question related to cyst by Saili. Her baby has gonadal cyst, and what will be the consequences in terms of delivery?
The baby has gonadal cysts.
Yeah,
How many weeks pregnancy?
30.
Okay. So see 30 weeks again, if there you are seeing some gonadal cysts, you nothing to be done about it. You are already in the time when the delivery has to happen. I don't think that will affect the mode of delivery. You can go for vaginal as well as cesarean delivery. I don't think that should make any difference to that. But obviously, baby will have to be evaluated after birth, and then decisions about further management of the baby will be taken. But it will not affect the mode of delivery, I think. Yes, please.
Thank you, ma'am. Uh, I'll just take a few more questions at the end. So Madhuri is she's saying I'm 24-week pregnant and it's IVF twin pregnancy.
Hmm.
Cervical stitch was done. Is there any chances to normal delivery in this case?
The cervical stitch has been done, it means there were chances that she may abort or this thing. IVF twin pregnancy, usually people go for cesarean because they don't want to take the risk of vaginal delivery, because that's a long process. But there are indications like the how the baby are lying in the uterus. So yes, this also I did not touch. So this is called the presentation of the baby. So if the baby's, see, normally the baby's head is below, a single baby also, the head is below and the foot part is above. So that is a normal presentation. That's called the cephalic presentation. The head is below. So in that case, if in a twin pregnancy also, if these are cephalic twins, then vaginal delivery can happen. Uh, but if the first baby is breech, which is when the head is above, then in that case the vaginal delivery is not preferred. So same applies to the twin also. If the first baby is cephalic, they may allow vaginal delivery after opening the stitch, and if it is not cephalic, any other presentation, then they will ask for a cesarean delivery. But I was just saying that mostly people who go for IVF do not want to have the risk of vaginal. Risk is in the sense that the close monitoring is required for 16 to 18 hours, whatever. So that is it. But here I've made that point for in singleton babies also, cesareans may be required when the baby is not in the normal position, that is non-cephalic babies also.
Thank you, doctor. Meg is asking, it's her second pregnancy, but first pregnancy is C delivery. Then second is compulsory C or normal delivery.
So this I told you before also. It's
Yeah.
not necessary. It's not compulsory. We have to assess you again this time. And if the previous cesarean, there is no indication this time for a cesarean, we can allow a vaginal delivery. And not only by spontaneous labor, if you don't go into spontaneous labor, we can induce the labor also and allow you vaginal delivery. So it will be it should be assessed again.
Thank you so much, ma'am. There is just one last question about epidurals. What are the pros and cons and risk? I mean, this can be a separate session in itself, and I totally understand. But if you could just summarize something about it.
Yes, so epidural analgesia is an important thing which needs to be talked about, and it is a very good option to reduce the pain perception in vaginal delivery. And I personally feel that it should be encouraged, enhanced, and patients should be asking about it. They should go for vaginal delivery with the help of epidural analgesia. The only thing is that it is to be given by an anesthetist, so that once the labor pains start and the cervix starts opening 3 to 4 centimeters, they put this needle, and through this needle they put in the catheter, and they give some drug painkiller through that. And it is really helpful because the patient can undergo a normal delivery smoothly with the help of this epidural analgesia. Lot of advancements in the type of drugs that are available are there now available, and most of the good centers will have this facility available. So you should ask for it and go for a vaginal delivery with the help of epidural anesthesia. It's good.
Thank you so much, ma'am, for answering so many queries of our expecting mothers and helping them make the difficult choices of pregnancy delivery. We are very, very glad that you gave your valuable time to us. Do you have any closing thoughts, ma'am?
um, as I think by now they must have understood that I am a doctor who feels that women who can go for vaginal delivery should go for vaginal delivery. You should not increase the risk of anesthesia, of the surgery, because there are complications. Not everybody has them, but there is a risk of anesthesia, there is a risk of surgical complications, hemorrhage, bleeding, infections, everything. And that placenta accreta which I told you. So I personally feel that only on medical grounds you should go for a cesarean, and otherwise you should go for a vaginal delivery.
Thank you so much, ma'am, for joining us, and thank you to all the expecting mother who have been going through this wonderful journey of pregnancy. You can continue asking questions on the AMA sessions that we hold, and ask the questions on the feed section as well. Our experts will answer. And thank you so much, ma'am, for joining us.
Yeah, thank you, Karishma. Thank you for inviting me here. It was a pleasure being here.
Thank you, ma'am.
Okay.
Bye bye.